And thank you for your time this morning. So welcome to everyone that's joining this webinar this morning, something that is obviously extremely important. And on the back of the breast cancer awareness webinar that we did that was very successful last month, one that is very close to our heart because the odds of prostate cancer are pretty much the same as breast cancer. Unfortunately, we never have as many men as women joining our webinars, Doctor. I think we probably can change that this morning. This is recorded, so we will put it on the web after. But I want to thank, before we start, Mediclinic as a whole and Dr. Salam Al Hasani for joining us this morning, taking the time out of seeing your patients to explain to us and how to prevent or how to look at prostate cancer in a different way. And what we will do is, once this is finished, Doctor, we will ask people if they have questions to put in the Q&A, and I might ask myself a few questions to you at the end, if that's okay. So without further ado, please, Doctor, if you want to start the presentation, we look forward to hearing from you. Thank you.
Yeah, thank you very much. Thank you very much, Philly, for nice introduction, and really appreciate. And we are so happy to be with you today, and hopefully we'll be with you physically in person next time. Actually, I have been informed we'll speak about men's health in general, including the prostate health, and not only the prostate cancer and prostate diseases.
Perfect.
So just allow me to give some introduction about some aspects of men's health, and we'll definitely concentrate about the prostate and the prostate diseases. I'm Salam. I'm consultant urologist in Mediclinic. I hope we have some of the audience from women's side, because usually now the principle or the concept of men's health are not only involvement of the men's, but both partners. We have the wives, sisters, daughters, mothers, all actually they are being involved because it's part of general well-being of the family. Just to give you an idea about men's health and why men's health is started actually basically in United Kingdom in 1994, when they found out the average age of men became much less than women, because most of the women's health, breast cancer awareness and uterine ovarian cancer awareness started much earlier before any men's health awareness programs. So they found out this have a positive impact on the woman. Accordingly, they decided to go for men, then followed by Australia, then in Canada, and finally United States have the initiatives to initiate the Men's Health Network worldwide. When we speak about men's health and what does that mean, men's health, usually we'll go for our guidelines. And it means that in general, it's a general well-being of the man, including medical. And with this medical, we include cardiovascular system well-being, mental health, endocrinology well-health, psychological, in addition to other aspects of men's health, including prostate diseases and other urinary diseases. Yes, for sure, as being a urologist, we'll concentrate more about the urological part of men's health today. And I think my colleagues in cardiology and endocrine family physician, they have also such program for orientation about other aspects of men's health. I just want to realize here that testosterone, which is important androgen in the man, is not only affected for sexual health and fertility, but also is affecting the well-being of the heart, muscles, bones, and in general well-being. So when you speak about a human being and a man here specifically and hormones, we're speaking about the whole body, not speaking about a specific organ. And what happened? I think I reached to thank you.
Oh.
Okay. Yeah, we have some. Yeah. Okay. So this is actually what we speak about women's in men's health. Women's in men's health are important part because, as we said, they are wives, daughters, friends, mothers. So being involved, and any problem will affect the men, definitely will affect the whole family. And when we speak about wives, we speak about if there are some diseases can be transferred between partners. Actually, I remember before COVID, we have a program. I can say 50% of attendance in men's health program was women, and it was really amazing. Everybody was caring about the men's health issues. And what our goals in general for this awareness programs to save the men's life and to avoid any premature mortality, and also to increase the physical and mental health, of the or well-being, and reduce the cycle of violence. In addition to that, we thankful for UAE government and getting the significant involvement. You heard about the marathon has been done a few days ago for supporting men's health done by His Highness and other governmental institutes. These are the main diseases can affecting the men in regarding for the urological aspects. And I will concentrate about three main parts, which are the infertility or fertility, sexual dysfunction, and the prostate diseases. Infertility, as you know, and 1/3 of the causes could be due to men, another 1/3 due to women, and the remaining part will be combined or unexplained. Here, just in part of the awareness, actually to avoid over-investigation or the over-evaluation. For fertility, we are seeing some patients coming after get married in 2 months, 3 months, and they are starting to have evaluation for fertility. And scientifically speaking, this is too early, and usually you have to start investigation after 6 months of unsuccessful trials. For a couples who are living together, doesn't mean that when a couple they are meet every now and then. It doesn't work like that. You have to be together minimum of 6 months, and you have to be without any protection or any modality for preventive pregnancy. How to evaluate? Well, there are a lot of approaches for management of these cases, whether medical, minimally invasive, or surgical. We'll go for them shortly. When you evaluate medically, we need a full assessment. See, we are seeing now we have telemedicine and a lot of electronics consultations going on. For fertility, this, in my opinion, doesn't work. In fertility, you need to sit, usually the couple together with your doctor, and you have to elaborate all the relationship and what's going on, because there are a lot of factors can be from the history itself can be corrected, whether about the timing, using any cream, lubricant, all these can affect. And sometimes even physical examination, there are some anatomical changes in the female or male factors can lead to this problem. So initial physical evaluation with the history is very important if you are to avoid any unnecessary investigations. Then definitely for the men, we start with the hormone, they start with the semen analysis. Here, at this point, if your doctor told you that the semen analysis is normal, and you have a normal relationship, the men, till here, we usually will stop having any further evaluation. But if there's any abnormality, then we go further for hormones, endocrine assessment, and other urological assessment. So the idea, avoid, in addition to properly evaluate it, also avoid any unnecessary evaluation. There are a lot of, depend on the cause, you can go for biopsy of the testicle, you can sperm retrieval, whether percutaneous or open method, and you can, in difficult cases, we can lead to IVF or assisted fertilization with different techniques. Surgical therapy, we are two main factors, fertility factors can be treated surgically. If there is any cause, obstruction, can be relieved surgically, and the well-known problems regarding varicose veins. And here also, we need to avoid or try to send the message for everyone not over-treat the varicocele or varicose veins on the scrotum. Varicocele is there in around 20 to 30% of the men, they have varicocele, not all necessarily to be treated. It depends on the grade, stage, symptoms, semen, if the semen factors are affected. So whenever you have varicocele, not always you need to be done any intervention unless have a significant impact on your semen analysis or you have significant pain. These are the only two indications for treatment for varicocele. Before we go for the sexual function, I want also to say some words regarding the people who's going to the gym and having some supplements, especially the steroids, androgen, growth hormones, all these injections here, right and left, to get better shape, more muscles. Please, if we have young people and going to the gym or being involved in that, I would advise you from this moment now to stop that. And if you have any of your sons, always send them the message that this will have a disaster impact in the future, can lead to the important fertility issues for the future. So please avoid having any exogenous steroids. Maybe you'll take some proteins, whatever, and this is also not recommended, but not as harmful as the steroid that you're taking from outside. If you have it, you stop from now. And most of the programs they are taking, they said they will do washout, will give injections, will give this one. Not always this will be successful. And we are seeing, unfortunately, cases coming here after having this injections for a long time, and they will have long-term problems. Regarding sexual dysfunction, you see the sexual dysfunction, we can divide it into three main types, which are the desire or libido, and the strength of the penile erection, and also for ejaculatory problems. So these are the three types. Usually when you go to the doctor, he will try to elaborate from your words which one is your problem, or any of these, or all of them. And regarding the treatment, there are different varieties of treatment, including medical therapy, minimally invasive. Definitely you heard about plasma therapy, PRP, P-shot, stem cells, shockwave therapy. These are effective therapies, but in highly selective cases. Although there are some people who are trying to get overuse of these modalities, it's not always effective in all the cases. Need to be properly evaluated before you decide that you are the proper candidate for this modality of therapy. And you keep in your mind, this therapy also is not lasting for long or lifelong. Usually you will have to have repeat this therapy every 2 years. Of course, in more difficult cases, we need reconstructive surgery or penile implants. Again, patients need proper evaluation, need cardiovascular assessment, endocrine assessment, laboratory, mainly the lipid profile, sugars, before we consider any treatment. Indication can be due to whether tablets, local gel, or some minor devices. These are the shockwave therapy and PRP or plasma therapy. It's, as we said, they are effective in highly selective cases, not for any case. And this is the guidelines that promoting, actually, American guidelines for this therapy, and should be considered. But again, we said in some cases. We'll go for our last topic, and I think everyone is now is hearing all around about prostate awareness. There is a SHANAP program is run also regarding awareness for prostate diseases and prostate cancer mainly. To start with, these are some photos of our program that we've done with our hospital director. Usually in any awareness program, the main objective is to prevent that disease if possible. Okay, and if this disease is any preventable, or you cannot prevent it, then the early detection is the main goal. Otherwise, you need if you cannot prevent, you need to go for searching any modalities for early detection. And to achieve these goals, you need to avoid the embarrassment. And this is we are seeing a lot of people now start speaking about their problem, because before they expect that speaking about the prostate disease as getting older, so try to avoid that. But all of us will have prostate disease as a man, so we need to speak about our problems. We need to keep on looking for the medical help on time, and we need to accept the treatment. And I'm always telling my patients, if you go to one doctor and you advise any treatment, you are not happy with this treatment, don't go home. Just instead of going home, go have a second opinion, go for another opinion before you just decide to treat yourself by Google. Google will never treat you. Google will just keep you in the more dilemma. So always it's wise to have a second opinion from another place. And very important, in most of the cases, we need to avoid unnecessary medical tests. We are seeing some people who's going for simple problems. You find them, they have a big list of investigation has been done. Usually we have some protocols or policies, guidelines to follow for each problem and which evaluation or test needed. These are the different ribbons for different programs, including breast and prostate. Why prostate awareness is important? To know why it is important, we need to know what is the prostate first. This is just a diagram, will show the difference between the female genitourinary system and the male. If you see in the female, the kidneys and ureters are both the same in the male. The bladder is the same in both sides. And if you see the lower part, the female urethra is very short, while the male urethra is long. This is why we have more complicated lower urinary tracts in the male than female, and because also the presence of the prostate in the most proximal part of the urethra, and we have of course the testicles and the secretion inside the semen. Is the prostate disease is the disease of elderly? This is not very correct. Prostate diseases can affect all age groups, starting from adolescents and adulthood, middle age, and elderly. But of course, for each age group, there is more disease likely to be affecting the prostate than other diseases. Where is the prostate location? As we said, the prostate located here in the lower part. This is the urinary bladder, and as you see, we have here these are the testicle. We give this a tube, and there another secretion will come all of them through the prostate into the urethra to during ejaculation, and it's just below the bladder, in front of the rectum, and surrounding the proximal part of the urethra. If we go, what is the prostate size? Usually most of the people, they ask, what is the prostate size? We say around 20, 22, 24. It depends from man to man, but usually it's a walnut size, but this can enlarge over time with age as part of aging process, and can sometimes reach to the size of tennis ball. To know what will happen if you have prostate disease, it's ideal to know the location that we know now, and we know the function. The prostate function is in producing a significant or very important part of the fluid during ejaculation, or the seminal fluid, which is responsible about keeping the sperms alive in the female genitourinary system. And this including enzymes and other materials. And to maintain this, the prostate also is having a prominent part to maintain pathways of semen and urine. So it will produce, it is a channel where the semen and urine will pass it through. So any disease affecting the prostate can affect the urinary system in addition to the sexual system, and mainly the ejaculatory part. And this is just to let you know that the prostate disease even is more common than hypertension and diabetes in men. And as we said, to achieve this goal, so we need to go for preventing the disease. Preventing the disease, we have initially to know what are the prostate diseases that can affecting the men. We have the prostatitis or prostate inflammation, and this is usually more common in the adolescent and young age group. Then we have the more common one, which is the benign enlargement of the prostate, and this is, we said, it's part of aging process, and usually starts after the age of 40 and became more clear after the age of 50 in most of the men. Of course, when we get older, the symptoms can start, the prevalence or the incidence of the disease can more, and prostate cancer, and also is more common in the middle age and elderly people. Always, most of the people, they will ask, is there a relation between the infection, enlargement, and cancer? There is no relation between them. The prostate infection is not a risk for cancer. Prostate enlargement is not a risk for prostate cancer. Every prostate cancer can happen even with normal size prostate. Prostate inflammation, as we said, is more common in the young age group, and where there's a prostate inflamed and so surrounding the urethra, so the patient will have symptoms of difficulty urination, frequent urination, in addition to pelvic pain. And the symptoms usually in prostatitis or prostatic inflammation will be more obvious than any other prostate disease, and may be associated with some sort of low-grade fever and getting worse. Usually these symptoms are more obvious or getting worse after any sexual contact. What is the age? We said it is the age is more in the adolescent and young age group. And what are the causes? We said in the beginning, the prostate is surrounding the most proximal part of the urethra. So any infection in the urine can find the way to the prostate. Because it's prostate, there are some small ducts opening inside the urethra, can go to the reflux, this bacteria inside the prostate, and lead to the infection inside the prostate. And also because of semen congestion for a long time, so this bacteria will find a way to have it more duplicate themselves inside and lead to infection. This is the diagram, will show us exactly what are the main problems that will happen in the men with the prostatitis or prostate inflammation. The main factor is that the patient will have pain, and not even usually the patient comes saying not having pain, or having more discomfort, which is affecting the pelvic organs and can reach to the lower abdomen and also upper thigh and genitalia. So this is the typical complaint of the patient with the prostatic inflammation, and definitely they will have some sort of voiding problems, which is difficulty in urination, frequency of urination, going to the washroom more frequent at night, and will lead to the sexual problems, mainly of ejaculatory problems. And definitely all these factors will over time, because usually the story of prostatitis will be weeks or even months, and they will lead to have significant impact on the quality of life. If you are from the people who have these areas of pain, you are always have lower abdominal cramp, you feel you need to rush to the washroom, have some problem in bed, and you can lead, of course, this to depression and even can affecting your work performance. Let us hit the goal and to find out what to do. The treatment advice, usually in case once you confirm the diagnosis of prostatitis, by the way, treatment diagnosis of prostatitis or prostate inflammation can be based on clinical findings, means, as we said, history, clinical examination in the clinic, and other tests, including urine test, blood test, scans, can be supplementary, but the diagnosis in 80 to 90% done by clinical way. Treatment will include the medications. You need to have a proper hot daily bath, sitting for 20 to 30 minutes to increase the blood supply, applying the area and make the inflammation less. Avoidance of alcohol and spicy food will not affect the infection, but can make the symptoms worse. So usually we advise to avoid them for the period of treatment. And also we need to have more fluid. And I think it's more important of all that, the compliance, because the treatment of prostate inflammation or prostate infection usually takes weeks and even sometimes longer. It depends on the case. Most of the patient, or a lot of patients actually, we see them, they are not compliant with their treatment, and they stop the treatment in the middle, they fed up, then they start the treatment again, and this will affect the response in general. So once you diagnose as a case of prostatic inflammation or prostatitis, please, you need to have a proper compliance, as this story or the treatment will take longer. It's not a simple infection can resolve in a few days. Of course, all these supplements, including healthy food, diets, more cranberry juice, cranberry fruits, and other green vegetables will help in having faster recovery for prostate inflammation. We'll come to the more common one, which is the benign enlargement of the prostate. And it is part of aging process. And just to make it easier, it's prevalent in around 50% of the patients or men above the age of 50. And this is just will let you see this. This is the normal urinary bladder, and this is the normal urethra and normal prostate. And this is how the urethra is coming. So the urine can come smoothly here. But see, when the prostate getting enlarged, you see what will happen. It will compress the flow. And this will lead to more, the bladder working harder against obstruction. So it's the wall get thicker. And this is definitely will affect the voiding pathway. And what are the symptoms? We have two types of symptoms. We call it obstructive, which are the hesitancy, means that when you go to the washroom, you will not pass the urine immediately. You need to wait for a few seconds till the urine is started. Intermittency means that the urine will be on and off. And the weak urine stream means that the urine flow is not as strong as before. You need to strain or push a little bit to pass urine. And always you have the sensation that you never empty the bladder. So you feel always you want to go once again, maybe after half an hour, less than an hour, or to pass the urine once again, because definitely you are not emptying the bladder completely. And we have the irritative symptoms, and more obvious one, once you start to notice yourself, you need to wake up at nights more frequent, 2 times, 3 times. And if you see this frequency increasing over time, means that you in men above the age of 50 or 45, that it indicates that you have some issues. Most probably you have some issues regarding the prostate. Can be prevented. First of all, we need to know it is not a life-threatening, and it is not a cancer, and it is not precancerous. So it doesn't mean when you have prostate enlargement, this can progress to a cancer. If cancer want to happen, can happen even without enlargement, and even without infection, or without even sometimes any symptoms. It is not a life-threatening condition, and it is part of aging process. Can be prevented. Very unlikely we say we can prevent it, but we can say we can delay it. We can decrease the problems by having healthy food, healthy sexual life, and mainly avoidance of the fatty food, fast food, and other unhealthy food, and increase the amount of vegetables, berries, and different types of nuts. These can act as antioxidant, can affect also the chance of having cancer, and at the same time also will keep the prostate more healthy. These are in general the symptoms that we spoke about. What are the treatment of BPH? This slide, I like it the most because this actually summarizes the treatment of prostate from the less invasive to more invasive. And depends on the patient severity. Maybe we'll start if the patient we classify them as a mild case. Maybe just we'll do some modification, mainly of the diet and caffeine and so on. And having some exercise can help in decrease the severity of the symptoms. The first line therapy will go for medication, which is the usually either 1 or 2 medicine, or the new modality, which is the rhythm, and which is then vaporization of the prostate. And the second line of therapy is more, it's slightly more, still minimally invasive, including microwave implants like stents, whatever, and laser therapy. By the way, all these modalities of treatment doesn't require any wound. It's all done through the normal passage from the urethra, but there will be slight difference in the and then how invasive is that procedure. And of course, it will depend from person to person. Medication, we have two types of medicine, one of them to relieve the obstruction and dilate, which is called alpha blocker. And if the prostate is too big, usually the doctor will prescribe other medicine to decrease the volume of the prostate over time. And the effect usually starts in 3 months time. So this is why most of the cases will be give combined therapy. Herbal therapy is very well known and the studied therapy for the prostate. We said the minimal invasive therapy, which is the rhythm therapy. Actually, we proud that we are here in Mediclinic. We introduced this modality of therapy into UAE for more than 2 years and have very successful result. And other techniques, including laser therapy, which is including a green laser, holmium laser, thorium laser. Of course, it's always depend on from case to case. So the one which is suitable for rhythm maybe is not suitable for the other one. So you need to have proper evaluation and discuss what is your priorities. This is an old, now it's from history, doing open prostate. This is how to go through the normal urethra and how to do the resection, which is the traditional way of having the prostate out. These are the latest therapy, this is what we said, rhythm. It's very simple. You go for having steam injection in the prostate, and this will cause a shrinking of the prostate over time. There is another one, we call it Urolift, which is the clipping of the prostate, opening the channel. And also we have the different types of laser, with the green laser. And we said it's the one which is suitable for this person, maybe not suitable for that. So you need to have proper evaluation. I'm sorry, maybe it took too long, but this is the last one, which is the prostate cancer. Although the prostate cancer actually is the most common diagnosed cancer in men, and the second cause of death in men after actually lung cancer. But at the same time, I don't want everyone to get panic and scared. Here, we are here in the awareness. We don't want people to get panic. We want them to get aware. I want to tell you that prostate cancer is a curable cancer if you diagnose it in the early stage. And usually it is not a fast growing cancer. It's very slow growing cancer, but you need to keep it in your mind and to evaluate it. Even there are some people, they said no need to evaluate for prostate cancer if it is slow growing. But since we have the available facilities and curable facilities, so I think it will be wise to do awareness and to avoid the comorbidities or morbidities which are mainly related to the prostate cancer. And just to explain what we mean by it is not rapidly growing, usually it's the easiest way to compare. If I compare the prostate cancer with the breast cancer in the female, if a female has a breast cancer of 1 centimeter and the man have a prostate cancer of 1 centimeter in the prostate, the female breast cancer from 1 centimeter to 2 centimeter, it will take 1 month to get double size. So imagine the growth is too fast. While in the male, the 1 centimeter to be 2 centimeter in the prostate, it will take around 10 years to be having double size. So this is will make that the prostate cancer is not very fast growing cancer. And what to do for the awareness or to screen for the prostate cancer. First of all, you need to see your doctor. Okay, you have to evaluate it properly, and he will do 2 main things: clinical evaluation, including rectal examination, and the blood test, which is the PSA, which is a prostatic specific antigen test. And this is to evaluate for some level, and accordingly will decide. Accordingly decide we need to go for further tests, including ultrasound or MRI scan. And it depends. If you are from the risk group, he may go for further. If not, risk group, maybe this annual test is more than annual test, not more than that. When you will do this PSA and rectal examination, We need to know about the values. Usually the values is different from the according to the age, prostate volume, but in general, any PSA which is less than 4, we regard it as normal PSA. When you will start, ideally above the age of 50, but if you are from the risk group, having the family history of prostate cancer, or from the female side, breast or ovarian cancer because of the similarity in the gene, then you can start as early as possible as 40. And then from your doctor evaluation from 40 will tell you that the next visit will be after a year, 2 or 3. It depends on evaluation and the risk factors. How often is retreated? We said it's yearly unless otherwise indicated. Can be prevented. We said we cannot prevent, just to make it very clear, we cannot prevent prostate cancer, but we can decrease the chance of having prostate cancer by having healthy food, avoid fatty food, having more green vegetables, more berries, and more nuts, special and many types of nuts, having regular exercise. These are all decreased, but will not prevent. And although there are studies from Mayo Clinic saying that having more sexual activity you will have less chance of having prostate cancer. How to treat a prostate cancer? Prostate cancer can be treated by surgery, which is by open, lab, or robotic method to remove the whole prostate if being diagnosed of prostate cancer. And by the way, it's not all for all the cases. Your doctor will classify based on the age, other comorbidities, PSA value, and other scans. Will put for low risk, moderate risk, and high risk, and accordingly will decide which modality of the treatment. And other modalities can be just giving an X-ray, radiotherapy, hormonal therapy, chemotherapy, or any combination of the above. So there are different modalities of treatment for prostate cancer, and usually the surgery and radiotherapy are curative. And once you have them in a proper way, you will have complete cure from the prostate cancer. These are just some people, famous people who die from prostate cancer because although they are famous, they are not screened well, and there are people who won the battle against prostate cancer, and they did a surgery on a proper time. These people, all of these people, they did actually surgery for prostate cancer and get cured. These are some awareness program and have a healthy prostate. And we are ready for a question. Just to summarize, for prostate cancer, we don't want to have over evaluation. So the annual checkup, usually with the clinical examination blood test, maybe a scan is more than enough, annual one. And for the regarding the other aspect of fertility and men's health, please for the young people to avoid mainly exogenous steroids and hormones. These are the main maybe messages I want to give it now.
Fantastic, Doctor. Thanks very much for that. Very informative.
Thank you.
Even if it's long, I think it's important to go through the whole thing. I'll invite anyone that wants to ask questions to put it in the Q&A at the bottom of the screens if you have any questions. I have a couple of questions for you, Doctor.
Yeah.
The first couple of questions that came up yesterday, I was talking to a dear friend of mine that is in the belief that dairy products have a direct impact on prostate cancer. Is that something of a myth, or is that something that's proven that dairy products are linked to this type of cancer?
Dairy products, no. See, as we said, there is no proof about some will cause the prostate cancer or just will give you away from prostate cancer. There is no proof about that. But in general, for any cancer, we advise the people to avoid fatty food because the fat food will give more nourishment for the cancerous cells, and we avoid to have more antioxidants, which are more available actually in different types of nuts and different types of vegetables. But dairy products, there is no, up to my knowledge, there is no real studies to prove that dairy products even having important impact of prostate cancer.
Sure. We have another question coming from the panel. What medication can I take off the shelf or for the doctor to give? I don't know if it's related to a cancer or for prostate health. I don't know if the person that put this question would like to elaborate a little bit on the question, but is there anything off the shelf that you can take for a prostate health?
See, usually for a patient, as we said, over the counter, if you want to take for a proper, there are people they taking some supplements for a proper or healthy prostate, and they can take it more actually about having better sexual life. There are many supplements, including any supplement with containing glycoprotein. This is very good for the prostate health. And instead of taking this, if you want to have a natural one, usually it is there in tomato and mainly in cooked tomato. If you have a cooked tomato, they have this glycoprotein will around 100 times cooked tomato will be more than enough. But if you speak about the medication for prostate enlargement and to shrink the prostate, as we said, there are herbal medication, anything containing the sarcalmato will be very effective for shrinking of the prostate volume. But with this, we need at least 3 months to start its effect.
I mean, this was leading to my next question, actually, doctor, is that tomato ketchup is very, very good for cancer in general, I think, because it's the most concentrated paste of tomato you can find. Is that true?
Yeah, it is true. It is true. It's containing, there is some specific material, and this will have, there are some studies that can have some impact of reduction of the chance of having a prostate cancer. Yes.
Okay. We have another question. Does PSA between 6 and 9 means prostate cancer?
See, when we speak about screening, it's different from diagnosis. So when you speak about screening, means that we will do a test that will give us, will subclassify our patient. This is a risk of prostate cancer, and this is have no risk. If the PSA above 4, usually will classify the patient of a possible case of a prostate cancer, but does not mean till now he has prostate cancer. As we said in the beginning, if the prostate volume is too big, PSA can be higher. The age of the patient, if the patient above the age of 70, for him 6 will be normal, but need to be properly evaluated. But if he's the patient, they say the volume is small, 30 milligram or milliliter, and the age is 50, and he has the PSA of 6 to 9, no. At this point, doctor, he has to evaluate him for other causes of rising PSA, including infection, retention of the urine. Usually, even the patient, if he has sexual relation a night before and he did the PSA were raised, so he need to be properly evaluated. If all these factors excluded and found that the PSA is high, at this point we need to go further. Now currently we'll go for MRI scan first to see if there is any abnormal tissues within the prostate, especially with the new MRI of high resolution. And if so, then we'll go for a prostate biopsy.
End this by thanking Mediclinic. I think it was fantastic. A lot of good information on there. If you need to talk to us about critical illness insurance, as Holborn is an insurance broker, we need to talk to you about the financial side. Half maybe suffering a critical illness. We will be in touch with the people that have logged in today to get your feedback. But thank you very much for all the attendees. Thank you, Dr. Al Hasani. Thank you, Mediclinic, and have a good day all. Thank you very much.